ALS, amyotrophic lateral sclerosis, is a disease that disrupts the communication between the brain and the muscles. The lack of communication from the brain causes the muscles to break down over time, losing function and eventually leading to paralysis. While risk of getting ALS can occur at any age, chances do increase with age. Those between the ages of 40 to 75 are the most common, with men being more likely to acquire the disease before the age of 65. Additionally, if you're a military veteran, your chances to develop ALS are 1.5 to 2 times more likely.
The progression of ALS is rarely linear, meaning that you cannot determine how quickly the disease will develop. However, the average life expectancy is between 3 to 5 years, with some rare cases living up to 20 years. You will generally start to see weakness in muscles involving the hands, arms, legs, and feet, and then speech and swallowing. While it is a rare disease to contract, with a little over 5,000 cases reported in the U.S. annually, it is still important to know about since there is no known cure for ALS at present, and 90% of people who develop ALS had no prior history of it being in their family. As ALS progresses, patients become a risk for fall injuries. To help prevent this, giving them access to equipment such as electrical wheelchairs for mobility, canes or walkers for support, slip-resistant socks and guardrails in the bathroom and shower for balance can help reduce the risk of falls. Also, removing throw rugs can further reduce any risks. Collaboration with your care team is crucial to helping maintain health, wellness, and remaining as independent as possible, as they will help with adapting to the changes as ALS progresses. Those diagnosed with ALS should focus on activities that help maintain their mobility, communication, and a healthy, balanced diet. Once speech begins to become impaired by ALS, it is important for the caregiver and the patient to establish how they wish to move forward with their communication, whether through the use of slowing their speech to articulate better or repeating back what was said. The caregiver must understand that it will be frustrating for both the patient and themselves due to an increase in misunderstandings onset by the disease. Remembering to have compassion, empathy, and patience will be key to assisting those with ALS. Caring for those with ALS can be hard because it means having to change your entire lifestyle around to help support and care for their loved ones. To prevent burnout, it's important for caregivers to remember to also take care of yourself. This means getting adequate sleep, proper eating, having a strong support group to help ground you, and most importantly, still making time for yourself. If you yourself aren't healthy, then you won't be able to take care of your loved one. If you would like to learn more information about ALS or about how you as a caregiver can help support both you or those diagnosed with ALS, you can go to www.alsa.org or visit one of the local ALS associations of Texas located in Plano and Dallas. So remember, empathy, patience, a solid understanding, and still taking time to care for yourself are all key to ensuring that you give the highest quality of service to those diagnosed with ALS.